to start getting you some answers about the coronavirus here from a local expert. We're joined on the phone, as usual, here by Dr. Erika Hamilton, a microbiologist from UMass Amherst. Dr. Hamilton, hope you're well. Thanks for coming on.
Thank you for having me.
So we're going to start here with a question that has to do with your neck of the woods. UMass has a team that has actually been compiling and standardizing COVID-19 models. We just want to ask you off the bat here, what can you tell us about this? Are you seeing anything, any good trends?
So what this group and it is in Dr. Reich's lab, what they're doing is all across the country, different medical schools and different universities, their departments of public health or epidemiologists are using mathematical models to predict the number of COVID-19 deaths in the future. And during hurricane season, we all know that the meteorologist puts up the map with the hurricane on it, and there are all these different models that show where the hurricane is going to go, depending on what condition you look at. This is kind of the same thing. We're depending on what the conditions are of this math formula that epidemiologists use, you will get different predictions for the amount of COVID-19 deaths. And what the Reich Lab at UMass did was, how do we compile all these in one place, and how do we kind of standardize them all so that you can compare the models to each other? And if you go to the UMass homepage, you can look at the information yourself. And one of the things that struck me is that there's one model that shows that if we keep our current interventions in place, that Massachusetts will peak for COVID-19 related deaths sometime in the next 4 weeks.
Okay, so 4 weeks out from something along those lines. It's very good to know as well that we're here. We've also seen models at times can be very confusing and inaccurate. So it's good to know that you guys are compiling it all into one source for everybody here. So moving on here now to Ron P. A question from him, one of our viewers. Every year we have relatives come up from Florida for the summer months. What would the quarantine protocols be for these snowbirds?
Well, they might not want to come up because they're coming to one of the parts of the country that is currently hardest hit. So depending on when they plan on arriving in Massachusetts and how they plan on getting here, they may want to change their travel plans. So some of the things that the CDC recommends is, for example, if they're driving up from Florida, you might not want to stop in New Jersey and New York because those states have been so hard hit by COVID-19. If you're flying, what can these people do to make sure that they're safe in an airport or on an airplane? And then once they do get here, they really should stay completely away from other people and quarantine in their residence for 2 weeks because there is a chance that they picked something up on their travels from Florida to Massachusetts.
All right, we have about 60 seconds left here. And the other question here comes from one of our viewers as well. With lots of talk about a potential second wave this winter, how might it be different than we're experiencing right now?
Well, it's going to be compounded by the flu because if COVID-19 and an influenza, the yearly influenza epidemic happens at the same time, you're going to have a lot of very sick people, and some people may end up getting both infections. Not at the same time, but one after another, and that could be really dangerous. And if you have a lot of very sick COVID patients and a lot of very sick flu patients, that will really overwhelm our hospital system more than it already is.
All right, Dr. Erika Hamilton, some great information there. Also some startling information to hear that we could possibly be 4 weeks out from our own peak. Dr. Erika Hamilton from UMass Amherst giving us some insight here, some valuable insight that we need to hear. Be sure to tune in, everybody, each weekday here at 12:30 as we have a doctor answer your questions or other experts within this global pandemic we're all trying to get through day by day.